Hello, thank you for listening to our case report of cardiac chest pain, an atypical early sign for Lyme disease. This case report is written by Dr. Gabriela Orasanu, cardiology attending, Dr. Jose Calvo, cardiology fellow in training, and myself, Fong Wen Vo, PGY1 internal medicine resident at Summa Health System in Akron, Ohio. Before we get started, I want to introduce a little bit about Lyme disease and carditis. According to the CDC data, there are roughly 35,000 cases of Lyme disease reported each year. Some common early manifestations of Lyme disease include erythema migraines, fever, or fatigue, but patient can also develop migratory arthritis or carditis, for which the most typical association is conduction system disturbances like atrial ventricular block. Lyme carditis can also manifest with palpitation, pericarditis, myocarditis, and left ventricular failure leading to chronic cardiomyopathy, or it can also mimic an acute myocardial infarction on physical exam and ECG. Healthcare providers need to maintain high suspicion for Lyme carditis even in the absence of common symptoms to avoid chronic myocardial dysfunction and/or unnecessary pacemaker placement. We want to present a case of a 20-year-old male with no cardiac history, presented with a sudden onset of intermittent episode of mid-sternal chest pain that radiated to his back and neck. It occurred at rest and became aggravated by deep inspiration and leaning forward. He admitted to working outdoor but denied tick bites. His initial vital sign and physical exam are normal. His ECG showed diffuse subtle J-point elevation and PR depression in inferior lead, but otherwise unremarkable. His initial workup revealed normal toxicology screen and electrolyte panels, an elevated ESR, CRP, and CK level, especially a troponin I level of 10.6 that peaked at 11.8. While in the ED, he had a transient Mobitz type 1 second-degree AV block, also known as Wenke back. His transthoracic echocardiogram was normal. A CTHS was done that showed no sign of thoracic aortic aneurysm, dissection, nor pulmonary embolism. We also did a left heart cath with coronary angiography that showed no evidence of coronary artery disease. His cardiac MRI showed normal EF of 63 with no myocardial edema, no scar, no LGA enhancement. Infections panel including COVID-19, CMV, RSV, influenza, HSV, HIV, Hep C were all negative. A Lyme serology was collected. Patient was treated as a myopericarditis on colchicine and was discharged after symptom improvement. After discharge, his Lyme serology confirmed an acute Lyme disease. He was brought back into the clinic for treatment, and then he reported a newly developed erythema migraine rash on his thigh and left knee pain. He was then started on a 10-day course of doxycycline immediately. At a follow-up visit, patient reported complete resolution of all symptoms and no ECG changes. His troponin and CRP also significantly improved. This young patient presented with an acute chest pain consistent with myopericarditis and found with brief episodes of asymptomatic Wenke back AV block. Since Lyme-related third-degree AV block may develop in untreated patients, regardless of age, there was a concern for developing severe conduction disease. However, Wenke back can be normal in young patients, and in this case, patient had a complete resolution of AV block without further intervention need. Therefore, his troponin elevation, on the other hand, was more of a definitive evidence of myocardial injury, likely putting this patient at a higher risk of developing chronic ventricular dysfunctions if left untreated. Since 2019, Lyme incident has become increasingly prevalent in Ohio. We have a table here that shows Lyme incidents in Ohio from the year 2012 to 2021. For the last 10 years, the number has significantly increased. Providers in Ohio and other Midwestern states should have Lyme disease in their differential diagnosis of atypical presentation of myocardial infarction-like syndrome so that appropriate and prompt antimicrobial therapy can be started and prevent AV block and chronic cardiomyopathy from developing. Thank you for listening.